far as 3 years. All right, and then these are the different states that you may choose. It will automatically query Nevada, but if you have patients who said that I moved from Arizona, you can check Arizona, and then it will query Arizona's P&P as well. And then you have to click on the agree to the acknowledgement and then click search. And this is how a P&P report looks like. This is a true and actual P&P report. We remove the names to keep the patient anonymous. So what information do you see in the P&P? It tells you the date the report was generated and the date range. We queried 4 months. It has all the names of the patient went by and all the names that they filled prescriptions under. A lot of times patients do that so that they don't get linked up together, so that so their P&P reports are separate, so that they can get by with doctor shopping, things like that. Patients can get sneaky. Their date of birth and the different addresses that they may have given or different addresses that they have lived at. All right, and then it gives you this nice little summary here in the middle. It tells you in the 4-month time frame, they received 29 prescriptions for controlled substances from 21 prescribers from 14 pharmacies. All right, how many of you are seeing 29 doctors in 4 months? Hopefully you aren't, right? Getting 29 prescriptions, seeing 21 prescribers, okay? So this is a true P&P report. You also have here the date filled, when it was written, the drug name, the quantity, and the day supply, the name of the doctor, the pharmacy that filled it, the morphine milligram equivalence dose, and the payment type. Commercial insurance is insurance. Private pay is usually cash money. All right, so this P&P report, you can see here, patient just got tramadol. And it sounds okay, but until you kind of dig into it, the patient received tramadol on 1/8/2017 for 15 tablets. On 1/9, got tramadol again for 28 tablets. 1/10, tramadol, 30 tablets. 1/12, tramadol, 60 tablets. As you can see, this patient has a problem with tramadol, right? They received 11 prescriptions for tramadol in January 2017. Why not just one prescription from one doctor to cover the month? Why 11 different practitioners, right? So this is what you get from the P&P, and this is the value of searching the P&P. You see patients like this, all right? And you would hope Dr. 11 would have pulled up the patient P&P report and would have seen this and said, you know what? This patient has a problem. Maybe I should talk to them. Maybe they should get help. I'm sure a lot of doctors did pull up the P&P report and refused to write for this patient because of what they saw. And as you can see here, they went to different pharmacies and they changed from commercial pay to cash, commercial, cash, commercial, cash. And that's because your insurance probably won't cover it and it'll reject it. So they have to switch back and forth between payment types. All right, so this is a true P&P report. I wanted to give another example because this patient was a dentist shopper. All right, he was in Vegas. He's one of our bigger cases. So John Smith so this is a 2-month P&P report, 11/1/2015 to 12/31/2015. John Smith in 2 months received 25 prescriptions from 22 doctors from 18 pharmacies. All right, so basically he was receiving a prescription almost every other day. And he liked dentists because it was easy. He had like a loose tooth or something. He said, I'm in pain. I don't need a pull today, but if I can just get something to cover me next couple of days, I'll come back. He would never go back. Maybe you saw this patient. Perhaps you did. Because he was all over Las Vegas seeing almost every dentist. So essentially, he received a total of 12 prescriptions for controlled substances November 2015. One almost every other day from a different practitioner, all for hydrocodone, Norco. Okay, not huge supplies, 15, 5, 28, but if you add that up for a month, it's like, I don't know, 300 tablets? It's a huge amount, right? And that's the value of pulling up a patient's P&P report. Here's another example. Betty Smith. All right, this this here is a 2-month time frame. It doesn't look as bad and as egregious as the other 2 P&P reports, but here she got large quantities of alprazolam, Xanax, right? On July 5th, 2016, she got 60 tablets, 30-day supply. Following day, got 60 tablets, 30-day supply. The following day, got 90 tablets, 30-day supply. This is the whole prescribed 365 thing, where you shouldn't be prescribing to a patient who already received that medication for that diagnosis. Okay, Zolpidem. She also liked Zolpidem. So from 7/9/2016 to 8/5/2016, about a 1-month time frame, she received 5 prescriptions for Zolpidem, all for 30-day supply. Okay, so again, these are really egregious patients, but this is why it's important to pull the patient's P&P report. So these are doctor shopping behaviors to keep an eye on and to look for. Multiple doctors, I'll get to you in a second, multiple pharmacies, high drug quantity, switching back and forth between payment types, odd combinations or lethal combinations. This is called the Holy Trinity, where they're getting a narcotic, a benzo, an anxiolytic of some sort, and soma, a muscle relaxant. If you see those 3 combinations, it's highly possible that they're abusing. Obviously, there are some patients that may require all 3, but not likely. Duplicate similar therapies and overlapping written and filled dates. You had a question?
What happens to these patients after you identify them? Like what happens to them?
What happens to these patients when we identify them? We actually have a person at the P&P designated to look for these patients, because doctor shopping in Nevada is a felony. And what we do is, depending on the person, we do extensive research on the patient. If they have a violent history, we don't try to intervene. We refer them over to law enforcement to look at these patients. We also contact each practitioner that actually prescribed to that patient and each pharmacy that filled for that patient, so they know that they're prescribing to a potential doctor shopper or filling for a potential doctor shopper. But if we do research and the patient doesn't have a criminal history, the Board of Pharmacy will take on that patient and we enroll them in the pre-criminal intervention program. Meaning we have an intervention officer at the Board of Pharmacy who talks to these patients, get an idea of why they're doing this. If they have an addiction, we put them in an addiction treatment program. If they truly have pain and they just haven't been managed well, and that's why they're just going from ER to ER, then we put them in pain management and then they get treated that way. All right, so I did say it's unlawful, it's a felony to doctor shop in Nevada, and this is the statute. And I provide that to you so that you can tell patients, if you see that their P&P report looks really crazy, you can say, look, you may have a problem, I want to help you out, but doctor shopping is a felony. If they find out, they can refer you to law enforcement. And usually that's like the last straw. They're like, oh my gosh, I don't want to go to jail or prison. And so they're willing to get help at that point, hopefully. All right, so what is the self-query? So again, it's an older law that happened in 2015. It's not a result of AB 474, but you have to do 2 self-queries every year, okay? So every 6 months you have to do a self-query, and this is how you do it. You have to have the ability to sign into the P&P, and once you're signed in, you click Menu, you click My RX, and you can go back a whole year or you can go back 6 months. Again, you only have to do this every 6 months. All right, and then if you have multiple DEA numbers, you just check the DEA number you want to search. Otherwise, it will just search the one DEA number that you have. And then you click search, and this is a sample MyRx report. And the reason why it's so crucial to look at this is it tells you who you've prescribed to and who's filled prescriptions for controlled substances under your name. And a way to identify people who are writing fraudulent prescriptions under your name is to do the self-query. So this report has your DEA number, your name as a doctor, where your DEA number is registered under, and it tells you the date of the prescription, the name of the patient, the drug name that was prescribed in the pharmacy that filled the prescription. And then if you notice, oh my gosh, I've never prescribed to Sally medical assistant or Sally dental hygienist, all right? why is she on my report? Maybe she's calling in fraudulent prescriptions. Maybe she's writing fraudulent prescription. It happens. I know you trust your staff, but it happens, okay? They can take advantage of your DEA number. All right, so you may be thinking, oh gosh, there's so much to do, mandatory PMP use and everything, and you may think, Nevada, what is Nevada doing? We are not the only states requiring doctors to run PMP reports. As of January 2018, 40 states mandate doctors to query the PMP before prescribing controlled substances. 14 states require the pharmacists to. Pharmacists in Nevada aren't required to query the PMP, but a lot of them do. But 14 states require the pharmacists to. All right, and PMP is making a difference. Again, I live and breathe this, so that's why I'm talking a little bit about it. So in 2012, both New York and Tennessee required doctors to query the PMP. It became a mandate. And they saw a huge reduction in the number of doctor shoppers. In New York, a 75% reduction in doctor shoppers, and Tennessee, 36% reduction. All right, so we talked a lot. And I want to summarize some of this stuff because you're probably overwhelmed. So this is a summary. And I say the summary for dentists in most cases. This doesn't cover everything. Summary for dentists in most cases when writing initial prescriptions for the management of acute pain, okay? This isn't for everybody, but this is a summary. You must have a bona fide relationship. Check. You probably are doing that already. Have a diagnosis and treatment plan. Check. Check the PMP. Right? Do the patient risk assessment. Assess for the following if applicable. Remember the list of things that you must assess if applicable? These are things I feel would be applicable to you guys because you guys are writing for acute pain, not ongoing management of chronic pain. So these are things that you must assess. If you write the prescription, it must be less than 14 days, must be less than 90 MMEs, you must do the informed consent. And then include on the new prescription for the controlled substance, the patient's date of birth, ICD-10 code, DA number, and day supply, right? I feel like, obviously I'm not a dentist, I don't practice, I feel like, you know, if you just follow this, every time you write controlled substances, you will be following the law. Yes?
Question. This is obviously going to limit probably what we prescribe
Mm-hmm.
to patients, and I think that's the goal of it. Are there laws for undertreating pain?
Are there laws for undertreatment and pain? Mm-hmm. I think if you were a doctor and you were prescribing patients a lot of narcotics and then you just cut them off, right, and you put them in withdrawals, I think that would be unprofessional to do. But if a patient comes into your office and they insist that you give them pain medication, you don't have to do that. You don't have to prescribe them pain medication. Oh, doctor, I'm really in a lot of pain. Take some ibuprofen. You don't have to treat their pain.
Has there been any studies formulated comparing those states that require both the pharmacy and the doctor to check the PMP versus those who just check the PMP as doctors?
Great question. I'm sure there are studies. I just don't have them available. But if you send me an email, I can look into it.
I'm just wondering because you say you don't have to check the PMP, but you enter the data into the PMP as a pharmacist.
Mm-hmm.
And you have to do that within 24 hours?
Yes.
So what's to stop somebody from checking the PMP as a pharmacist prior to dispensing the drug? Why wouldn't that be in the best interest of the state and the patient for the pharmacy to be checking that because that's the source of the medication?
Yeah. What my experience is, you know, before this became a law, pharmacists were doing the majority of the checking. Okay? That is my personal experience. Why isn't it mandated? Again, it just wasn't written in the bill. It could be something that can be brought up because maybe there is a benefit that the pharmacist check the PMP as well, like double checking, you know, checking the doctor's work essentially. But it's just not required in the state of Nevada. Yeah.
Seems like a loose end.
Maybe it is. Yeah. All right. So what happens? Yes.
Follow up on the dosages and that sort of stuff. If we're checking the several doctors in the same week getting 30-day supply, is the pharmacist allowed to say, I'm sorry, I can't give you this prescription because you've already got several days of supply left?
Great question. So the pharmacist has a corresponding responsibility. Is that the right term? Yeah. Corresponding responsibility, meaning they also have to verify that the prescription is legitimate. All right. So if they have a source that says that that prescription isn't legitimate, meaning the patient already received 30-day supply of hydrocodone and now they're receiving another 30 days, they can and have the right to refuse to fill that prescription. Because their license is on the line as well. Because if that patient overdoses, the pharmacist will be looked at as well as the dentist. Okay. So what happens if you don't follow AB 474? A lot of you are probably wondering, okay, what will happen? I'm not going to do any of this stuff. This is what will happen. All right, you're subject to professional disciplinary action by your licensing board, but if your patient dies from it, you could be subject to criminal liability. Okay, so what happens? How do they know if you're not following the law? Well, the Board of Pharmacy is tasked with looking at the P&P, combing the P&P to find doctors who may be breaking the law. And if we find that you're breaking the law, we have a responsibility to report that out to law enforcement, licensing board, to the practitioner, to the pharmacy, depending on who's involved. All right, so if I happen to stumble across one of those patient reports and I'm like, these doctors are all prescribing to this patient, that's not okay. Then what I do is I report that patient's name over to the licensing board because they're now violating, they committed a felony. I report them over to law enforcement as well. Okay, so if it involves a practitioner, I report them to law enforcement and their licensing board. If it involves a pharmacy, I report it to law enforcement and board of pharmacy. If it involves a patient, such as a doctor shopper, I report them over to law enforcement, licensing board, the prescriber, and the pharmacy. Okay, but you have to be like so bad for us to report you. I mean, it's not like we report you just because, oh, this one time you didn't check. But you have to be doing something really bad, okay? Because we have thresholds that we meet in order to do those reports. All right, when we send over those reports